Snow falls against a midnight blue backdrop. Snowy hills emerge, as well as winter trees. OPRE Year in Review 2019. The view fades into OPRE's office. Throughout this video, the white OPRE logo appears in the bottom right-hand corner. Naomi Goldstein, Deputy Assistant Secretary for Planning, Research, and Evaluation.
Happy New Year from all of us at OPRE. As we enter a new decade, we want to share some highlights from 2019. First, we're excited about the new Evidence-Based Policymaking Act signed last January. It provides opportunities to enhance our work building evidence to understand and improve the effectiveness of ACF programs and services. For example, we're working with our ACF program partners to articulate learning agendas as outlined in the Act. Next, for the 7th year in a row, Results for America recognized ACF as a top-performing federal agency in the areas of data, evidence, and evaluation. And in October, the Data Coalition recognized OPRE's work with its first-ever Evaluation Officer Award.
Emily Schmidt, Deputy Director.
The 5 principles of ACF's evaluation policy, rigor, relevance, transparency, independence, and ethics, guide all aspects of our work. For example, the principle of transparency drives the way that OPRE thinks about disseminating our work to make it more accessible, engaging, and useful. In 2019, OPRE sponsored over 110 publications, and we're proud to report that in 2019 we more than doubled our Twitter following and launched an Instagram account.
Mark Fuccello, Director, Division of Economic Independence. The OPRE Division of Economic Independence had a very busy year. We released 3-year follow-up results from the Health Profession Opportunity Grants National Evaluation. We released findings on the impacts of different types of wage subsidies on employment outcomes for public assistance recipients. And we released findings on impacts of job search and placement services for TANF recipients. Also, we entered into a major agreement with the Social Security Administration to study innovative approaches to addressing disability-related barriers to work.
Mary Bruce Webb, Division of Child and Family Development Director.
The OPRE Division of Child and Family Development had a busy year too. We launched the Title IV Prevention Services Clearinghouse. We finished data collection for the 2nd National Survey of Early Care and Education. We published findings from the first ever national study of migrant and seasonal Head Start programs, classrooms, families, and children. And we launched our new Child and Family Data Archive, providing access to early childhood data for secondary analysis.
Maria Woolverton, Division of Family Strengthening Director.
The OPRE Division of Family Strengthening was also busy. We published impact findings from the MyHope and MyHope Strong Start studies of evidence-based early childhood home visiting programs in collaboration with HRSA and CMS. We launched 2 new continuous quality improvement initiatives evaluating use of the Breakthrough Series collaborative approach. We funded a new project to learn more about human services programs in rural areas, exploring unmet need and opportunities to strengthen program capacity. And we published a digital essay about 4 responsible fatherhood programs participating in the Parents and Children Together evaluation, sharing key findings from the study with quotes and video clips from program staff and fathers who participated in the programs.
Valeria Butler, Division of Data and Improvement, Senior Research Analyst.
The OPRE Division of Data and Improvement was busy too. We launched the TANF Data Collaborative to help states better use the TANF data they already collect. We launched a project in partnership with ASFE to help states link their child welfare and Medicaid data. We responded to nearly 60 requests for funding state IT systems that touch multiple federal programs, supporting a streamlined, interoperable approach to data use. And we awarded our first interoperability demonstration grants to support states and localities develop innovative, replicable approaches to make it easier to share and use data across systems.
Twitter logo, @OPRE_ACF. Instagram logo, @OPRE_ACF. Facebook logo, @OPRE.ACF. Website icon, acf.hhs.gov/OPRE.
Our motivation for all of this work is to improve human service programs and to better the lives of the children, families, and individuals that ACF serves. We'd love to have you join us as we head into 2020, so please sign up for our newsletter and follow us on Twitter, Facebook, and our new Instagram page. Thank you, and best wishes for an evidence-based new year.